about, which you couldn't see in my first video. So that is the machine, and it is the Microdermabrasion machine, and it is SilkPeel dermal infusion, and I will talk about that later. Okay, so I'm going to move this around and maybe give you a tour at the same time. So Cowell Laser is in Brantford on Brant Ave in a old home. So the room that I have for my business or treatment room, I guess would be what would have been maybe like a sitting room or something back in the day. So I've got like a beautiful fireplace. I have all my product on the mantle. Sorry if I'm making you dizzy. There's my treatment bed and the SilkPeel machine again. That's my laser machine. And then my little prep station with some more product on it. And then the door, which leads into the doctor's office, waiting room. All right, so let me just go set this up again so you guys can get a good idea of what I'm talking about. And just bear with me for a second. I had this set up like perfectly before. All right, and I'm gonna turn this light on too so it's really bright so you can see me and everything that I'm talking about. Okay, so there we go. There's where I was sitting before. We'll do this again. This works out better because now you can actually see the machine. Whereas before I was like talking about it and I'm like, well, they don't really know what it looks like. So, okay, so microdermabrasion. So microdermabrasion is a non-invasive treatment for your face that works in conjunction with a vacuum to suck up the dead skin cells that I am scraping off with a diamond tip, as well as infusing your skin with a solution, and here at Cowell Laser I have 4 different ones to choose from, so depending on your skin type and your skin concern, I'll choose one that's best for you. And yeah, your skin gets infused with this solution and it's amazing. Like, it's the best treatment ever. So I usually get this done, I do it to myself twice a year. I would say that that's probably good enough. You know, if you have good skin, you're doing your due diligence as far as your cleansing and your moisturizing and your exfoliating 3 times a week at home. So if you do have, you know, acne, or you need that routine because you're not high maintenance and you don't, you know, have all those routines at home, then definitely come on in. I would suggest, usually for my acneic clients, once a month. But that totally depends on, you know, how much you have budgeted for a service like this. So the solutions that just came in the mail are as follows. So the vitamin C, and this one I usually use on smokers for some reason, and my sun worshippers. I find this one works best for people who lack luster, who need that glow, who need that oomph in their skin, that, you know, they're just lacking. They have that dull gray complexion. So the vitamin C is packed with antioxidants, and it's just a nice glow for your skin. So that's one of the 4. The next one is Lumixil. Oh no, I can see this. Lumixil is my go-to for anyone who has pigmentation issues. So even for my skin, you can see with this crazy bright light the freckles that I have. And I usually notice that after a SilkPeel treatment, you'll notice some freckles may go away because we're taking that layer of skin off that freckle was on. But at the same time, you might notice that more freckles appear. So your face is most comparable to an onion. You've got just tons of layers, okay? So we're not quite sure like what is on each layer. I know how much damage or how deep it goes. So, you know, you might do 1 or 2 treatments and get rid of some freckles, and, you know, you've got this like clear complexion, and then come back in for another one, and then all of a sudden you've got these random freckles all over. So this is good. Like, this is the process that you need to go through to renew your skin. It's cell turnover. You know, you got to keep taking off so that it keeps replenishing. It's just this whole, you know, roundabout effect that goes on. So basically, in a nutshell, the microdermabrasion in a way is not, I don't want to say damage because that's like the worst word to use, but causing almost like tears, like little, you know, like just like little tears or little tiny like microscopic injuries almost in your skin, so that new skin has to reappear, so that new skin has to repair it. And this new skin is virgin skin that hasn't seen sun, hasn't had, you know, a pimple, hasn't been poked at, hasn't had product on. So that's kind of the idea behind microdermabrasion, in my own words. I love it. Like, it's such a cool concept, and it makes so much sense. So, like I was saying, sidetracked. So Lumixyl is the one that I would use for people who have pigmentation. So yeah, someone like myself who's got like the freckles, or the older you get, you're gonna have like the keratinized skin. It's kind of like, you would probably see it on your grandparents. They're just bigger versions of freckles. So that's what I use on those skin types. Okay, the next one is skin hydrating. Skin hydrating has hyaluronic acid, which is amazing. It's what your body naturally has that gives it that almost like volumizing lift. Okay, so it's a natural sugar that we all have in our body that we naturally deplenish as we get older. So infusing your skin with this is just, it's a no-brainer. The skin hydrating also has aloe, which is totally beneficial for your skin. I usually use this on people who come in here and they're just like, I don't know what I need, like, I don't know, I just want it done. So they don't really have any concerns. When in doubt, hydrate. Everyone needs hydration. And this is the one I usually use on me because I have drier skin. So I need that extra moisture. And then the next one, or last one I should say, is the skin clarifying. And this is my go-to for anyone who has oily skin or who has acne. So, like, all of these solutions are amazing with the microdermabrasion. But this one specifically, because if you are coming in here and have problematic skin, whether it's cystic acne, hormonal acne, you just have problem skin. The whole concept of, you know, taking off the dead skin cells and then infusing your skin with this makes the most sense because, you know, if you're using product at home, whether it's from the doctor and, you know, it's a topical steroid or antibiotic or whatever, or if it's, you know, one of those oxy pads that you can buy or Proactive or anything, whatever you're using to treat your acne at home with, if you're not exfoliating your skin, that product or, you know, medication isn't penetrating deep enough. So with getting this done and taking off, you know, a couple layers of your dermis, your skin, and then infusing your skin with something like this, the salicylic acid, it's penetrating deep into the dermis to the root of the issue. Literally the root of your acne where the bacteria is festering and causing all that havoc. So it makes sense. Like it's just such a great treatment to get done. Usually I find with my acne clients, it tends to look worse before it gets better. And I'm sure if you have acne, you've probably heard that before. It's common. Because of the microdermabrasion being an abrasive, sandpaper-like texture, you know, it is causing irritation to the skin. With the SilkPeel machine that I have different tips that I can use. So there's ones that, you know, are extremely abrasive, that are really, you know, like really jagged. Feels great if you have thick skin. If you're just, you know, a sun worshiper and your skin is like leather, you're gonna love it. But if you are someone that does have acne and it is more sensitive, then I can definitely use something that's, you know, less abrasive. And then, you know, you can kind of work your way up to it. So it's totally dependent on you. It's totally tailored to each person, you know, the treatment that you're getting done. So I'm going to show you the wand that I use for this treatment. So this is the wand. It's still, I should have taken it apart. I had it all put together the first video I did. Okay, so let me just take this apart really quickly. So this is the wand that I use that I would do like 4 or 5 passes over your face with. And I will turn it on, the machine, after I've kind of talked about it. Last time I turned it on and my camera fell down and it was really loud. It was just a hot mess. So I'm going to be a little bit more methodical this way, this time around. Okay, so this is the wand. As you can see, there's 2 different tubes. So one of them is a vacuum. So it's sucking up the dead skin cells that I'm scraping off. And then the other tube is where the solutions that I was just talking about flows through the tube, out the end where the diamond tip would be, and then into your skin. So this is one out of like the 7 tips that I have. And you can kind of see, if I can get the lighting, I don't know, but it's abrasive. It's like sandpaper. And this one's, I think this one's somewhat in the middle as far as the abrasiveness goes. It's kind of my go-to one. It's like the perfect, perfect touch for everybody. But I can also use different settings on the machine as far as, how strong the vacuum is. Because the stronger the vacuum, the more you feel the abrasive texture. Okay, so tip is on. And then I would put my lid on so that the solutions don't go spraying all over my treatment room. Okay, and I will turn on the machine, but I'm just gonna like prep it a little bit better because last time everything fell down. Okay, actually I'll just hold it. So you can hear it right now. So it sounds like a motor, but really it's the vacuum. And I just want to show you how suctiony it is. Okay, so I'll come nice and close. So here. See that? That's like a vacuum. That is the vacuum. So I'm just doing this so I can show you how strong it is. And right now, it's like a little over halfway. It's like 7 out of 10 as far as like the strength goes for the vacuum. So what I do with it, I'm going to turn it off now. Okay, what I do with it is take the wand and do kind of like, I draw lines on your face. It makes sense to me because I have it all mapped out. But I just go over your skin with the wand and it pulls it, sucks up the dead skin cells, excuse me, with a vacuum, and then infuses the solution into your skin. So I do that all over your face, cheeks, nose, around the mouth, forehead, and I usually go along the neck as well. So I do that. It usually takes about 4 or 5 passes all over the face before the solution is finished. Okay, and then when you're done the treatment, not everyone likes to see this. I think it's really cool. I end up showing you what is in the jar at the end of it. So basically, all the solution would be in here. It's about halfway full, and then when I put it into the light, all you see is dead skin just floating around in here. I think it's the neatest thing ever, because I'd rather see it in this jar than on my face. So it's just kind of cool to actually, feel the treatment, feel what you're having done, and then seeing the result of it. So it's really satisfying. And then you'll start to notice too, if you are someone that's going to come in frequently enough, like once a month or whatever, you'll notice that the more you come in, gradually the less skin is going to be in the jar, because you're maintaining that upkeep of exfoliation on your face, right? So it's really cool. So yeah, I think that's it. So that's the Micro Machine, the SilkPeel Dermal Infusion. I talked about the 4 solutions that I have here at Cowell Laser. Showed you the machine, kind of gave you a tour of the office. And yeah, so definitely hit me up, email, if you want to book in for your first or your next microdermabrasion. And if you have any questions about pricing or just, what to expect after the treatment, I can tell you, most people, like probably 9 out of 10 again, really are fine. Like it depends, everyone's different. It depends on your sensitivity level. And, you know, some people go red or pink even if you just pinch them or scratch them. Like they're really sensitive that way. So I find most people, you'll leave with, you know, a slight pinkish glow. I think it looks good. I mean, you're bringing all the blood to the surface. You know, it's that rejuvenation, oxidizing, or oxygenating, I should say, treatment, right? So it's you're going to have that plumping effect right after your treatment, and you're going to have that, you know, stimulation in the cheeks and stuff like that. So it just looks healthy. And then over the next couple days, you might notice that you might be heat sensitive. And I really strongly advise not to go out directly into the sun and like tan after getting this done, because